Hello, my fellow transplants. Welcome back to another episode of Immigrant Health Tips with Dr. Amma. I'm your host, Dr. Amma, and today we'll be talking about a very important topic which has been making rounds in our communities, and we're talking about measles. Now, measles is bad, and it's something that should concern all of us, especially as immigrants. There is a measles outbreak in Alberta, and if you live in Alberta, you may have heard about this. So if you or your loved ones have recently moved to Canada, especially with young children, I think this is a very important conversation that we need to have. Measles is actually here, and we need to talk about ways that we can protect ourselves and invariably protect the community. So let's get into it. Number one, what is measles? Many of us grew up hearing back home that measles, what it was or what it should be, and I'm guessing because of the advent of all the vaccines and modern medicine, you might be wondering, why are we still talking about measles? I thought this was old school. Well, the truth is, measles is one of the most contagious diseases in the world. Yes, and it spreads like wildfire. And once there's an outbreak, it's usually very hard to control. And this is because it spreads by virus and is actually spread airborne through coughing, sneezing, or even touching contaminated surfaces. And what that means is this: somebody with measles walks into a room and they cough or they sneeze, the virus can remain active in the air for up to 2 hours, and that can be quite scary. So the next thing I want to talk about is what are the signs and symptoms of measles, and the most important thing, let us know what the red flags are, when to seek for help, things to watch out for. It usually starts off as a regular fever, right? And this is why people sometimes will ignore it. But then the symptoms get worse, and then here are the things that you need to watch out for. Number one, there's a high fever. A high fever which could be lasting for several days, 3 or more days, followed by or plus cough and runny nose, watery eyes, and then later you might notice some small white spots inside of the mouth. And these are what we call Koplik spots, and it's a unique sign of measles. After some time or shortly after, you might notice some red blotchy rash just across their body. Usually starts on the face, around the hairline, and spreads down the body. Once you see that rash, it means that the disease is already progressing, and that's why early recognition is key. So another thing is, why should you be concerned? Now, some people might say that measles is just a childhood illness, it's not very serious. But my dear, no, that's not true. Let me tell you, measles can be very deadly, especially for young children, for pregnant women, and people that have weak immune systems. And it can lead to serious complications like pneumonia. This is when there's a lung infection, and this is the most common cause of death from measles. Another complication, though rare, could be encephalitis, and this is when there is swelling in the brain that causes permanent damage. I've seen this happen a couple of times, and it's usually not pleasant. The other thing is severe diarrhea resulting in severe dehydration, and as we know, that could be quite dangerous for children. Another complication that can arise could be blindness. And as for pregnant women, measles can actually lead to a miscarriage or even premature birth. And that's why we must take this outbreak very seriously. So I'm also going to answer when to seek medical attention. Here's the things you should do if either you or somebody in your family starts to develop symptoms. Here are things that you can do that will help. I'll suggest calling a doctor immediately. If you're in Alberta or in the environs, you could call 811. Don't just walk into a hospital or a clinic, because measles can actually spread easily. So you want to call ahead and inform them about the symptoms. And you never know, there could be people in the waiting room of that clinic who are really sick and can easily pick up this disease, and it will cause even more severe issues for them. Also, the next thing you can do, stay home and isolate. If you or your child has a fever and a rash, avoid contact with others, especially newborns, elderly people, and unvaccinated individuals. You want to stay home and isolate. And if you want to seek help, you can also use virtual health platforms that are available in Canada. You can also register for those and talk to a doctor if possible. Another thing you should do is to monitor for breathing difficulty. This could suggest pneumonia. Monitor for things like confusion, which could suggest a brain inflammation, or even seizures could also suggest a brain inflammation. These are signs of like those severe complications that we talked about. Also, you might need to seek medical or seek emergency medical care if you notice any of these symptoms. The next thing we want to talk about is prevention, which, as far as I'm concerned, this is the best defense. And that's good news because, my people, measles is completely preventable with the MMR, that's the measles, mumps, rubella vaccine. And if you've recently moved to Canada, or if you've moved as an adult, you might not be fully vaccinated. And here are the things that you can do. You can try to maybe check your immunization records back home. And if you're not sure whether you got at least 2 doses of the MMR vaccine, go and talk to your doctor. The next option is to get vaccinated. Children should actually receive 2 doses. Usually in Alberta, we receive the first one around 12 months, around 12 to 15 months, and the second one could be given around 4 to 6 years. But in Alberta, we can also offer it at 18 months. For children, I think Alberta government has also added a new schedule for children between ages 6 months to 12 months to just provide them with that added protection. However, that does not confer immunity for the rest of their life, so they still need to get the vaccination at 12 months again. And for adults who are unsure, should at least get like a single dose or a booster dose. The next thing is to avoid close contact. So especially if you're in a place like Alberta where there's been recorded cases in different cities, it's important that you try to avoid sick contact because you never know what they might have, especially if you're in social gatherings like churches, grocery shopping. If you notice somebody is sick, it's better you try to avoid contact because you never know what they could be carrying. So once again, my dear transplants, measles is not something that we can afford to take lightly. There's an outbreak in Alberta, and it is a wake-up call for all of us. So if you're an immigrant, please check your vaccination status. Protect your children, your family, and our community. The power is actually in our hands. So my people, thank you again for tuning in to today's episode, and I hope you found this educating and enlightening. I'm not sharing this information to cause you more stress, and I'm all about de-stressing and stress management. So the goal of the whole thing is just to check yourself, check your family, see if there are ways that you can protect yourself a bit more. And if you notice any unusual symptoms among yourself or your family member, you can at once do the right thing and seek help by, calling 811, calling your clinic ahead of time, or using the virtual platforms to kind of get help. But if you start noticing severe symptoms, it's important that you seek emergency care. Thanks again for tuning in to Immigrant Health Tips. Don't forget to subscribe, share, and follow us for more health tips. Until next time, stay safe and stay informed. Bye-bye.